Hi, my name is Bertrand Dirk, and today we'll be discussing about what occipital neuralgia is. Have you been diagnosed with this condition or may think you suffer from occipital neuralgia? Well, today we'll be going into greater detail so that you have a clear understanding of what occipital neuralgia is, as well as understanding the possible cause and the potential treatment options that is available to help with its condition. So firstly, occipital neuralgia. So sufferers from having occipital neuralgia will present with a unilateral type pain. Unilateral meaning one-sided of the head pain, and it is often described as a piercing pain, a throbbing pain, or even an electric shock-like pain as well. It is experienced in the upper part of the neck, to the back of the head, or behind the ears. So that's where the location usually is. And if you suffer from this, you'll typically have it at the back of the head, as opposed to the front or the side of the head. Now, occasionally this pain may be presented on the forehead or the scalp, but usually it will be accentuated to the back of the head. Now, these areas correlate with the distributions of the greater and lesser occipital nerves. Other symptoms that can include are pain behind the eyes, visual impairments, tinnitus, which is basically ringing in the ears, and also nausea as well. Now, attacks generally last anywhere from a few seconds to many minutes. So, the primary role of the occipital nerve is to run sensory information from the back of the head to the brain. Therefore, all sensory information from the back of your head and neck travels through the occipital nerve. Now, sufferers of occipital neuralgia are often very sensitive and report very light stimulus, like light touching of the back of the neck, can actually cause debilitating pain and attacks. This could be because the link between the occipital nerve and the brainstem as it passes this sensory information to the brain. Now, given the similarity in symptoms of occipital neuralgia with those of migraine headache, it isn't uncommon for them to be left undiagnosed for long periods of time or misdiagnosed. So one differentiating factor between the two types of headaches are duration of attacks. Now, let's talk about the anatomy of the occipital nerve. Now, there are three nerve groups that form the occipital nerve. They originate between the second and third vertebrae of the neck. So, second and third vertebrae of the neck. Now, the greater occipital nerve innervates the semispinalis capitis muscle and also the scalp. The rest of the scalp and the area behind your ears are innervated by the lesser occipital nerve. Now, the second and third facet joints, which is the second and third joints of the neck, the area below the scalp and semispinalis capitis are innervated by the least occipital nerve. So this gives you a bit of information about the three occipital nerves. So what is the cause of occipital neuralgia? Generally, occipital neuralgia is caused by disruption of signals or input to the occipital nerves, those three nerves. Because the occipital nerves cover such a wide area, there can be a wide range of causes. And it has been reported that occipital neuralgia can be caused by nerve damage as such of surgery, stroke, or neck-related trauma. The damage that conditions like multiple sclerosis can have on myelin sheath covering of the occipital nerves as well. So what are the possible causes of or irritation to the occipital nerve? There usually are three main types. One is vascular, so there can be any vascular injuries or damages, vascular being blood vessels in and around the neck or up into the head. The second issue can be neurogenic, so nerve issues, neural damages in and around the neck to the nerves or up and over into the head. The third one is osteogenic. Osteogenic refers to joints, bones, so there can be degeneration to the joints in the neck, hypermobility or hypomobility, and also things such as arthritis to the joints of the neck and the base of the skull. All those three things, vascular, neurogenic, and osteogenic, can be a primary cause of occipital neuralgia. However, in some cases, patients will experience all of the symptoms of occipital neuralgia with no apparent cause found under investigation. Now, in these cases, it is possible that a sensitized brainstem is the cause of their symptoms. Now, this sensitized brainstem will receive typically non-threatening stimulus, such as a light touch to the back of the head, as an actual threat, and will respond by causing severe pain along the nerve's distribution. Now, as the brain continues to recognize this input as a threat, the brainstem becomes even more sensitive, causing the problem to become more recurrent. Now, normal daily tasks such as brushing their hair or scratching the scalp can then become regular triggers, causing this debilitating symptoms. So the other causes, like we mentioned, is the brainstem. So remember, if there is a fault or an issue to the neck, especially the first three segments of the neck, the brainstem can now be hypersensitive. The brainstem does house the occipital nerves and can then create and trigger pain going up into the head. So if we know the cause, what are the treatment solutions? Are there treatments to become effective for occipital neuralgia? Now, many of our patients who do suffer from occipital neuralgia have tried many different types of therapies, including non-invasive therapies, including surgical intervention as well, and also long-term use of prescribed medications. Usually all of this has a short-term effect, but however, it doesn't necessarily treat the cause of the problem. So, the other treatment methods or treatment options available, and what I would ask you as a question is have you seen a headache consultant? And especially, have you had your first 3 vertebrae in the neck thoroughly assessed to assess whether or not your brainstem is hypersensitive to create and cause occipital neuralgia? Now, if you haven't seen a headache consultant or have had your neck or brainstem assessed, then I would strongly urge that this is your next point of action, to thoroughly assess whether or not the brainstem and the neck is causing your occipital neuralgia. Now, if it is deemed that yes, the brainstem is the cause, then treatment can actually begin immediately and is actually very effective as well. If we know that the brainstem is the cause and it is hypersensitive, then desensitizing the brainstem by treating the upper 3 cervical spine of the neck can help at alleviating and reducing and stopping occipital neuralgia very well. So, my name is Bertrand, and I hope you have found value in today's video on occipital neuralgia, what occipital neuralgia is, the causes, and also the treatment options that are available for those of you who suffer from this condition. Thank you. Once again, my name is Bertrand Dirk, and I look forward to seeing you in another video.